Good Sunday morning. I'm Shannon Sims.
And I'm Charles Benson. Welcome to 4-1 Forward.
From today's TMJ4, this is 4-1 Forward.
Drug overdoses continue to claim lives at an alarming rate, and it's not just heroin and painkillers, but drugs like fentanyl and carfentanil, along with other opiates. And
the crisis spans all across the state, from the city to the suburbs to rural areas.
Heroin overdose deaths grew more than 800% in Wisconsin over the last decade. Opioid overdose deaths nearly doubled. And the rate of overdose deaths involving prescription opioids increased by 26%. Augie Badera's older brother Archie overdosed on heroin after getting caught up in drugs following high school.
What got a hold of him was the prescription drugs, and I think that really took him down.
The family has been very public about what happened to Archie in hopes of raising more awareness to the problem. In fact, Waukesha County recently received a $900,000 grant to provide follow-up care to overdose patients and conduct Narcan training, something that can reverse the effects of an overdose.
The more we talk about it, I think the more powerful and the bigger impact it's really going to have on each other.
Sergeant Amy Keppel has worked at Brown Deer Police for 17 years and says overdose calls were never this common when she first started as a patrol officer.
I don't recall this in my past experience, the frequency that we're having.
Wisconsin Senator Tammy Baldwin is worried Republican efforts to repeal and replace President Obama's Affordable Care Act will make fighting the opioid epidemic in Wisconsin harder.
An epidemic of this scale, of these proportions, needs all hands on deck. And that means local governments, that means state government, and Wisconsin has done some pretty important things on policy around the opioid epidemic.
Well, the battle to beat the heroin opioid crisis is being fought on many fronts, with law enforcement playing a critical role.
So that is why we invited Wisconsin's Attorney General Brad Schimel to 4-1 Forward to talk about this epidemic. Okay, you have been in the front row of this, not only as a prosecutor, but also as the lead prosecutor here in Wisconsin. Are we winning the battle, or can it be won?
We are making progress, and yes, it can be won. And you know, it's interesting, you introduced me as the law enforcement side of this. I spend a lot more of my time as Attorney General working on prevention efforts, because I liken this to a rowboat that is all full of water. And you've got law enforcement bailing water out one side and treatment professionals out the other side, and they're doing good work. The problem is there's a big hole in the bottom of the boat, and that hole needs to be patched with prevention. We have to stop more people flowing into this epidemic.
Okay, so what are you seeing now? I mean, you've been dealing with this for many, many years. What's changing? What's the dynamics of this? Why is this hole getting sometimes bigger?
Well, the most frightening change we've seen is the introduction of the synthetic fentanyls. Right. And these aren't made in a pharmaceutical company's lab somewhere. These are made by drug cartels that are getting the raw ingredients, usually from China. They're mixing them up in a lab. They can send it to you in the mail. People can go into the dark web, buy this stuff, and have it mailed to them. We have found some ways to intercept a lot of it, but we're not catching all of it. We never will. And fentanyl, just the amount that would be like a few grains of salt is deadly. We've had situations where law enforcement officers have come in contact now with these extraordinarily powerful opiates that are on the street, and the officer has made skin contact with it and dropped to the ground.
Wow. Senator Baldwin talked about all hands on deck. Do you feel they are?
They are. You know, if you went back 5 years ago, we had a lot of struggle on our hands to convince law enforcement to carry Narcan, to convince local courts to have drug treatment courts. There were a lot of struggles to convince the state to invest in prevention efforts and invest in treatment efforts. We had a lot of struggle then, but now you're really an outsider if you don't see that this is necessary and valuable.
So help me understand how the opiate crisis and epidemic is any different from the crack epidemic of the 90s, where lawmakers on both sides of the aisle now are looking at legislation that does not criminalize the victim, but sees to get treatment for them and not lock them up. Why is it different now?
Well, what's different is the system's different. The people in the criminal justice system, I like to call it, we've kind of crawled out of the caves. We thought for a long time that if you just lock people up long enough, they'd come out and they'd be okay. And we finally figured out, when you're talking about mental health issues and you're talking about substance abuse disorders, it is not enough to just give them a vacation from their problem by locking them up, because when they come out, they will go right back to the same behaviors, because the mental illness or the addiction, and oftentimes the combination of both, will draw them right back. So we know now we have to do different things. That's why treatment courts have been so effective at diverting people from ending up in prison, diverting people with the opiate epidemic from ending up in the morgue. And we're having great success with these things. So that's one of the reasons why I'm encouraged that we can get out of this. The other thing with the opiate problem, we have such a simple, linear path into opiate abuse.
Simple
we know,
by what?
Well, 80% of the people who start using heroin first got addicted to prescription narcotic painkillers.
So that's the genesis.
Because it's a cheaper drug.
Well, and
same high.
Well, because typically we know that 71% of the time they didn't buy their pills from a street drug dealer. They didn't get them from a doctor. They got them from a family member or a friend who either shared their prescription or they stole it from them. So we can eliminate 80% of those who start using heroin by just getting control over the painkillers. And we can get rid of 71% of those if people, first off, use your prescriptions only as prescribed to you. Second, store them safely and securely. People wouldn't leave a loaded handgun sitting on the counter of their home with people coming in and out. That'd be a dangerous thing to do. And yet not enough people used to think about what's in their medicine cabinet. What's in their medicine cabinet kills far more people than guns.
I've also talked to some addicts, though, who are recovering, who were prescribed these prescription drugs and have gotten addicted from the prescription that they owned.
Certainly.
I know you're also looking at that as well.
Absolutely. Certainly there are many who, experts estimate that about 10% of us are physiologically predisposed to become addicted to these when we take them. That's a pretty bad number.
Yeah.
And therefore, when those people become addicted, absolutely, they're heading down the path toward heroin. But an awful lot of the time, it's recreational use that starts it.
Well, you're talking about taking responsibility. I want to follow up on that point when we come back. Coming up on 4-1 Forward, is suing drug manufacturers the next step?
One Midwest state has already said yes. Is Wisconsin next? We will ask the Attorney General when we come back.
Plus, a free way to spend summer in the city, the program giving kids a safe place to play during time off from school.